Hello and welcome to this latest edition of the webinar series that's brought to you by the Interacoustics Academy. And the topic of today's webinar is on the mismatch negativity, which is an electrophysiological response that's used in various applications. Primarily it's a research tool with potential clinical applications. So what I'd like to do for today's talk, I would like to go through some of those principles underlying the MMN, as well as mention some of the potential clinical applications. So what I'm displaying on this particular slide here is just an overview of where I intend to get to with today's webinar. Now, first of all, I'd like to refresh some principles of cortical auditory evoked potentials, in particular the ALR, the auditory late response. Now, this is a topic that we have already touched on in a previous seminar, but just in case, what I'm going to do is just refresh some of the most salient points from that webinar with respect to the principles of the ALR, the ones that are relevant to today's topic, where we're going to extend matters into the discussion of the MMN, the mismatch negativity. So once we've gone through that refresher, we'll go through in some more detail the MMN itself, as well as via the aid of a video, a demonstration of how it can be measured using the Interacoustics Eclipse evoked potential system. And then just towards the end, we'll have a brief discussion on some of those potential clinical applications for the mismatch negativity. Now, this is, as we draw your attention to the right-hand side of the screen here, this is a schematic cross-section of the central nervous system. And if we draw your attention to the left-hand side of the screen, then this is a screenshot of an ALR that can be evoked by auditory stimulation of the central nervous system. So, in particular, I'm interested in the M1 response here and the P2 response here. The N1 generally occurring in a normally hearing adult around about 100 milliseconds in latency, and then the P2 somewhere between 150 and 200 milliseconds in latency. And this is for super threshold, well audible sound, where the amplitude might be typically somewhere in the range of 5 to 10 microvolts, as I'm showing here. Now, this ALR, as I'm showing with the arrow now, has generators within the auditory cortices on either hemisphere of the brain, within these circled regions. Now, these are not the only generators of the response, but the purpose of today's topic isn't really to go into the generators themselves as such, but really I'm just trying to convey with this slide here that we have with this response here, this N1P2 response, some index of auditory cortical activity that can be evoked in response to a sound. Now, this complex can be described as an onset response. In other words, a response that's thought to register some type of change in the acoustic environment. As such, the N1P2 complex is known or can be described as an obligatory response. It occurs as a result of sound detection by the sensory periphery, and it's primarily the physical and temporal characteristics of those stimuli, as well as the properties of the sensory system itself, that determine the features of the response, the amplitude and the latency, for example. Now, the change in the acoustic environment that triggers an onset response, like this N1P2 complex, it can be a change from silence to sound, as occurs in typical clinical measurements, where transient sounds such as beeps are played, or it can be an onset of silence in otherwise persistent sound, or it can be one ongoing sound which abruptly changes to another. All of these events might be expected to evoke some type of N1P2 complex, which can, at least for our purposes today, be considered as a marker that the auditory cortex has in some way registered the change in the sound environment. Now, such a marker is most commonly used clinically anyway to estimate the sensitivity of the ear. This is the lowest sound level that can be detected. Now, threshold estimation is probably the most common clinical application today. Simply we turn the volume of the sound down progressively until the N1-P2 complex is no longer observed, and the lowest sound level that it can be observed corresponds in some fashion to threshold. There are other clinical applications in relatively recent years. There's been increasing research as well as clinical interest in the use of the ALR to evaluate the success or otherwise of a hearing aid or cochlear implant fitting. Other uses might be in the research domain as biomarkers of neuroplasticity and learning. What I'm displaying on here is a screenshot for just going back to that more typical clinical application of threshold estimation. So what we're displaying is latency against amplitude here, and we've got traces here for 4 different sound levels: 60 dB HL, 40, 20 and 10. And what we can see is for the sounds presented at 60, we can see a very clear N1-P2 complex, and as we get the sound level increasingly lower, then the N1-P2 complex, the amplitude progressively decreases until the point where we can no longer detect the response. So that helps us to objectively estimate someone's threshold. So that's a brief overview, just to reiterate the key points there being that with the presence of this ALR, we've demonstrated objectively the fact that the sound is audible at the level of the auditory cortex. I mentioned that it's an onset response. It's evoked by approximately the first 50 or so milliseconds of a sound, and importantly, as I mentioned again earlier, it signifies change. So the fact that some change in the sound environment has taken place is signified by the presence. The detection of that change is signified by the presence of the ALR. Now, so if that's neural detection, now I'd like to think a little bit about what happens downstream beyond this stage of auditory processing. So what happens to sounds or the sound representation in the auditory system beyond merely neural detection? This is where today's talk looks to build on some of the concepts that we've just refreshed ourselves on here. One process that's thought to occur subsequently to neural detection is discrimination. Discrimination, or determining the two sounds, if they are physically different, then if you've discriminated between them, then you can hear that difference. So if the two sounds are physically different, but you hear them as the same, then you haven't determined that you haven't discriminated between those two sounds. So that's what's meant by discrimination. And in electrophysiological measurements, the evoked potential that can help us to index or to demonstrate whether or not that discrimination's occurred objectively is the mismatch negativity, or the MMN. So to draw a rather crude analogy with behavioural testing that some might be familiar with, then this is something like the clinician progressing through their behavioural audiometric test battery, where they might initially have a sound detection task such as pure tone audiometry, but they might then progress through to a sound discrimination task, for example in certain types of speech audiometry. Now, of course, I appreciate that that's a rather crude analogy in many ways, but it's true to say that the MMN is only evoked when a sound is perceived as different to another, according to certain limitations that approximate the behavioural discrimination threshold for the particular sounds in question. So what we have here is a waveform that occurs as a result of the process of discriminating between two sounds. Now, On this slide, what I'm showing is two broad categories of event-related potential, or evoked potential from the auditory system. On the left column here we have exogenous potentials, and on the right we have endogenous potentials. Now, exogenous potentials are those that are determined primarily by physical stimulus characteristics, and the MMN is categorized here because it's known as a pre-attentive response, in that the individual doesn't have to be actively listening to the two sounds that have been discriminated or not. This is a process that occurs prior to the attention having switched or been drawn to the two sounds. So it's a pre-attentive, and therefore it would be known as an exogenous potential. On the other hand, endogenous, and I've got an example here, the P300. This is a potential that's governed primarily not by the physical characteristics of the sound, but more the relevance and the meaning of those sounds. Now, it's not a completely black and white distinction between the two. There is a degree of attention, or at least passive attention, required to generate an exogenous potential from the cortex, and on the endogenous side over here, the relevance or attention towards a stimulus will be governed, at least to some extent, by the physical characteristics of the sound. Suddenly, if a louder sound comes in, then your attention is drawn to it, but that attention will be different according to how much louder the new sound might be compared with the old one, for example. But of course, as I mentioned, the MMN being under the exogenous category, and then we're just going to concentrate on recording conditions where we have just passive attention only, no particular active attentions needed to the sounds. So here on this slide we have a display of recordings that I've made using the Interacoustics Eclipse device to illustrate the MMN. What I'm displaying here are, of course, three traces. We have latency on the bottom and amplitude across the side here, and I'll just draw your attention to the top two of those three traces first of all. Now, these are averaged responses to sounds presented at 60 dB HL to a normally hearing individual. Now, the darker red trace, which I'm just highlighting here with the pointer, that corresponds to a tone of 1000 Hertz. The lighter red trace, which I'm just outlining with the pointer here, that corresponds to responses to a sound of 1032 Hertz. So the sounds are close in frequency, just 32 Hertz different to one another, much closer than is kind of normally used in audiometric testing, but nevertheless still far enough apart that a normally hearing individual should be relatively easily able to discriminate between them. So they would hear the 1032 Hertz sound as slightly higher in pitch to the 1000 Hertz beep. Now, although that's the case, in these particular recordings, as I mentioned earlier, the listener didn't actually perform any type of discrimination or active attention task. Instead, they just sat passively with watching closed caption silent movie while the recordings were made in the background, as it were. Now, what we can see in this circled region here is the classic N1 P2 complex of the ALR, the auditory late response. Now, that's the onset response, and we can see that onset response, the ALR, occurs to both sounds. So both sounds are detected, and we can see that the ALRs to the both sounds are similar responses, but they're not quite the same. For example, you can see from the pointer here that the amplitude of the lighter red trace to the 1032 Hertz sound is slightly higher in amplitude here than the 1000 Hertz sound, and the morphology is ever so slightly different as well. Now, we'll come back to that notion shortly, but for now let's just let's move our attention along the latency window a little bit to this region here that I've arrowed just beyond 150 milliseconds or so, where there are a clear difference between the traces. So here the light red trace is considerably more negative than the darker red trace. So there's this dip, this negativity. And this negativity is the mismatch negativity. It's the indication that the individual has heard a difference in the frequency of the two sounds. So the two stimuli have been registered as acoustically different to one another, and they've been discriminated in that sense. Now, if I draw your attention to the bottom trait here, what we have is known as a difference waveform. So what I mean here is where the response from the 1000 Hz sound, in this case, is subtracted from that of the 1032 Hz sound. So what we can see with this arrow here is a dip in the latency of the N1, and that shows that reflects the differences in amplitude between the two responses above it, shown as a difference waveform here as a small dip. And then as we move along the latency window towards where the MMN is displayed, then we can see an even greater dip, again, which is reflecting the difference in the negativity there in the amplitude of the response into the 1032 Hz sound compared with the 1000 Hz sound. So now we know what the MMN looks like and what it indicates. But before we go on to explain these waveforms that I'm displaying here in any more detail, I'd just like to spend a little time talking about the way in which the stimuli are presented to the listener in order to elicit that MMN. So this slide shows what's known as an oddball stimulus paradigm. An oddball paradigm is characterized by a train of identical stimuli known as standards. And in this schematic I'm showing standards here in red, and as you can see from the legend in the bottom right corner, these standards occur with a probability of 80%. Now, interspersed at random in this train of stimuli are other stimuli known as deviants, and these are illustrated in blue here. There's two in this small stimulus train, and the stimuli, these deviant stimuli, occur with a probability of 20%. So if you add the two together, we get 100% probability that a stimulus will occur at some point. Now, 80% of the time that stimulus will be a standard, it will be the same, whereas interspersed there'll be another type of stimulus that differs in some way to the standard. Now, as we saw in the previous example, there were two stimuli that differed in terms of frequency, and I think it's fair to say that the frequency deviant is perhaps the most studied type of deviant in the oddball paradigm, at least when it comes to the MMN. But there are other types of deviants, and they can differ depending on the particular purpose, the research question, or the clinical application. Potential clinical application that you might have in mind. For example, the deviant might be differing in level. It might be slightly higher, or it might be slightly lower than the standard. On the other hand, it might be duration. The deviant might be slightly longer, or it may be slightly shorter in duration than the standard. There are other more complex types of oddball paradigms. The list is almost endless. So for example, here we have a conjunction oddball paradigm. So we have stimuli with one level here shown with the large blue markers. Then we have a stimuli with a different type of stimuli with a particular frequency shown with the small red markers. And then the deviant is a conjunction between the two, in that it has the level of one but the frequency of the other. So I've marked these deviants here, where it's the large markers, but in red. And to identify this particular deviant as a deviant, then both features, both frequency and level, need to be analysed together to identify that a deviance has occurred. There are also increasingly more complex paradigms, higher order deviants, such as the physical characteristics of the sounds changing, but the timing or the order of them that is the thing that differs or deviates. As I mentioned, the list is endless, but for the purposes of today's talk, we're just going to limit ourselves to thinking about the more commonly addressed frequency deviant. Now, what I'm displaying on this slide here is a schematic of a neural network, and that's displayed with these cell bodies here and the various connections between them. And these will represent the neural generators of a memory trace evoked by a sound. Now, of course, in reality, the neural network which underlies the memory traces of a sound look almost nothing like this simplified schematic, which is in reality the neural networks that we're talking about here will be far more intricate and complex than it's possible to convey here. But for the purposes of our discussion, I'd just like to convey the basic concept of what's thought to happen when the MMN occurs. So now we have some sensory input from the periphery to the central auditory system, and when this input causes neural firing within the auditory cortex, we might set up a brief memory trace of that event, of that auditory change. So, for instance, what I'm displaying here with the red symbols is the memory trace that's evoked when we hear a sound to the 1000 Hz stimulus. Now, in this paradigm, we're not now in the oddball paradigm. We're just in the straightforward serial presentation of a series of 1000 Hz tones, and we can see in the bottom trace here the ALR signifying that the auditory cortex has detected that response or that sound, and our schematic at the top here shows a momentary memory trace that might linger perhaps within the auditory system, while in adults it's thought to short-term memory trace evoked by a sound is thought to last for some seconds, maybe 5 to 10 seconds. Now we'll just move on, because I'd like to show the memory trace to stimulus 2, that's the 1032 Hz sound. Once again, just to remind you, we're just talking not the oddball paradigm here, but the straightforward serial presentation of a 1032 Hz sound. So here we have once again the ALR is slightly different, but very much overlapping the yellow trace with the earlier one, and we have now a memory trace which again is ever so slightly different to the 1032 Hz sound compared with the 1000 Hz. So, but as I say, there's no MMN here because we're not playing the sound in this example in an oddball paradigm. Rather, the two sounds are just presented serially. For example, there might be perhaps 200 repetitions of each sound, and the traces just run one after the other, and we see a slightly different memory trace for each one. Now, in this example, I'm going to run the same schematic, but this time the two stimuli are going to be run as an oddball paradigm, where the 1000 Hz sound is going to be the standard, and that's going to be presented 80% of the time, whereas the 1032 Hz sound, that's now our deviant. It deviates slightly differently in frequency, and that's going to be presented 20% of the time. So, here's the ALR to the standard, and there's the memory trace above. And the frequent repetition of this sound, because it's the standard, has the effect of setting up that memory trace that I've shown in the schematic above, whereby the activity produced and then of course is reinforced by the many repetitions of the sound, lingers on within the neural network here, as I mentioned, for some seconds in a normally hearing young adult. So that repetition, the frequent occurrence of the stimulus here, sets up this memory trace, which is, we expect it to linger within the central auditory system. Now, within this period, this lingering period, if another sound appears and that sound is slightly different in some way and therefore produces a different firing pattern, and we know that this is going to happen sooner or later in our oddball paradigm, now this is when the MMN is triggered. So here we have the response to the deviant stimulus. This is the 1032 Hz sound in our example. So we have the ALR here, signifying that response has been heard at the cortex, and here we have the MMN, and up here we can see the overlapping memory trace here between the standard and the deviant. So the standard memory trace is lingering, and the memory trace for the deviant just arrives, and because there's a difference been detected between the two memory traces, it's this difference which triggers the MMN. So I'm displaying on here, these circles show where the two memory traces overlap, but these circles show the differences between the memory traces for the standard and the deviant. And by the process of comparison and the detection of a difference in the two sets of memory traces, this particular the mechanisms that underlie this particular process trigger the MMN that I'm displaying here with the arrow at the bottom. So now that we have hopefully conveyed some of the basic concepts, I suppose this begs a number of questions relating to the oddball paradigm, and it's perhaps worth mentioning some of those as well as some of the main features. So firstly, you can see the peak of the MMN can be expected to occur somewhere between, I guess, 150 and 200 milliseconds, depending on the onset of the deviant being registered as a deviant rather than just another standard. So if the standard and the deviant stimuli, if there's only a small difference between them, then it's going to take longer for the auditory system to discriminate between them, and so the MMN latency increases, and also the amplitude of the MMN gets larger. But as the process of discrimination is harder, as the difference gets smaller, then the MMN should occur a little later in latency. On the other hand, if the difference between the standard and deviant becomes larger, then the process of discrimination becomes a little earlier, and so the latency reduces, and the amplitude of the true MMN is expected to get a little smaller. But as the standard and the deviant difference becomes so large that the latency becomes earlier and earlier and earlier, then at some point it may become so early that it actually overlaps with the ALR, the N1P2 complex. And that N1P2 complex may boost the absolute amplitude of the MMN, even though the true MMN itself is getting smaller in amplitude. This also begs a number of questions relating to the oddball paradigm itself. So firstly, the size of the probability for the deviant occurring is all important, and secondly, the position in which it occurs within the stimulus train is also important. So first of all, let's just mention that the position first. So for the MMN to occur, then the auditory system needs to have that pre-existing pattern of neural activity to the standard. So what we'd expect, or what we'd hope for, is for the standard to be repeated several times at least in order to set up that memory trace before the deviant is presented. And then obviously the memory of the standard lingers for that period of time, so you don't really want the deviant occurring in the early stages of the sequence before that process has had a chance to occur. But secondly, of course, if the probability of the deviant increases, then there'll be fewer and fewer standards, so the memory trace to the standard will be less reinforced, or reinforced less often. And of course then the deviant itself will start to develop its own lingering memory trace the more frequently it occurs. So the more infrequent the deviant occurs, the larger the MMN. But you can imagine, of course, that this means that as the probability reduces, then this has to be weighed against longer test time overall. Because if you decrease the probability of the deviant occurring, then you'll have to present a greater number of standards to reach the requisite number of, or the minimum number of deviant traces that you might need to average the response. So let's try and illustrate some of those complex points by the use of some examples. So what I'm displaying here, as we read the screen from top to bottom, is I'm displaying 3 sets of traces, and there's 3 traces in each set. The top set, and we're going to read the screen from top to bottom. So the top set shows the traces of an oddball paradigm where the standard was 1000 Hz and the deviant was 1032 Hz. The middle set shows an oddball paradigm where we had 1000 versus 1500 Hz, and then the lower set, the response is from 1000 versus 3000 Hz. So you can see that the difference between standard and deviant is getting progressively larger as we read our way down the screen. So first of all, let's just pay our attention to the top set of traces. And here we have, and we looked at this earlier, here we have the MMN, and I'll just pop an arrow on there, both in the absolute traces and in the difference trace. And we also, again, we saw this example a little earlier, we also saw a difference in the ALR here, small difference in the amplitude here, which is also reflected in the difference trace. So, if we read our way down the screen to the middle set of traces, here the frequency difference between standard and deviant is increased from 32 Hz to 500 Hz. So that means that the discrimination task should be a little easier, so we'd expect the MMN to occur a little earlier. So here, I'll just pop that arrow on there. So here we can see the MMN occurring now a little earlier. We can also again see that difference in the ALR traces as I'm indicating here as well. And now finally, I'll draw your attention to the very bottom set of traces. Here 1000 versus 3000 Hz. So this is a much bigger frequency difference, so the discrimination task should be easier still. And as you can see with these arrows, here the MMN has occurred in latency, in terms of latency, even earlier still. And it's so early now that it's a complex that completely overlaps with the ALR. So if I just pop some latency lines on there, here we've got the latency of the peak MMN for the 1032 Hz deviant, the 1500 Hz deviant, and the 3000 Hz deviant. So you can see the latency is getting progressively earlier, and in the case of the 3000 Hz deviant, it's so early that it overlaps the ALR. And the ALR itself, if I pop this latency line on, basically doesn't change, not a great deal anyway, at all between the standard and the deviants. So the ALR is fixed. Now if we come on to this slide, then it's very much the same notion. We're going to read down the screen from top to bottom, and here we can see that the standard and the deviant difference is getting progressively smaller. So we're starting with our old friend again, 1000 versus 1032 Hz, but then as the deviant gets smaller we go to 1016 Hz, and finally 1004 Hz. So the discrimination task between standard and deviant is getting harder because the frequency difference between standard and deviant is getting smaller. And again, just referring our attention back to the top set of traces, then we can see the MMN there, as we looked at earlier, between the 1000 and 1032 Hz stimuli. As we come down to the middle set of traces, then the MMN now is getting slightly later as the task of discrimination gets harder. Now there is nevertheless still a difference here, a negativity that we can see as illustrated by the arrow, and also a small difference in the ALRs between the two. But then as we get to the very bottom set of traces, then now whilst we see the ALR to the two sounds, both standard and deviant, there's no negativity that we could say seems to correspond to any kind of MMN. So it's almost as if the two memory traces, both for the standard and the deviant, are so similar to one another that they can't be told apart anymore, and so the individual hasn't been, at least objectively, shown to discriminate between these two sounds. And it's also noteworthy that the ALRs are now no longer different to one another either. They almost overlap together, whereas in the other two sets of ALRs up here, there's an amplitude difference where the ALR to the deviant is slightly greater in amplitude. Now, once again, I'd just like to hit upon that point there about the difference in the ALR amplitude. So, in this set of examples, we're reading again from top to bottom, and the standard and the deviant difference is getting progressively smaller. So we've got a very easy discrimination task here, because there's a big difference between standard and deviant. And what I'm most interested in is, well, firstly we have the MMN occurring very early, because there's a large difference between standard and deviant, but there's also a large difference between the ALRs to the two sounds as well. Now in the middle set of traces, we have the MMN occurring a little later, because the discrimination task is a bit harder, and there's a smaller difference now between the standard and the deviant ALRs also. And then finally, in the bottom set of traces, not only did we not see an MMN, but there was, as I mentioned, very little difference between the standard and deviant ALR as well. So it's almost like we have a dual effect going on here, where when we see an MMN, we also see a difference in the ALR. And the earlier the MMN, also it seems the greater the difference in the ALR as well. And this dual effect has been ascribed to something known as the ALR adaptation effect. I'm just going to take a couple of slides to try and illustrate this particular point now. So the ALR adaptation effect. Firstly, I'll just draw your attention to the top right. This is the schematic of the central nervous system, and in particular, we're interested in at least one hemisphere of the brain where the auditory cortex resides, on the temporal lobe, and it's within this circled region that have expanded greatly into the figure that you see on the left-hand side of the screen. So this is the cortical sheet, and of course it's again greatly simplified compared with reality. This is very much just a schematic, but what you can see here lined up, many of the cells in the auditory cortical sheets that are thought to generate the ALR itself, or at least be involved in generating the ALR. Now in this schematic on the bottom right, I'm showing the periphery. That's the ear, and we can see the inner ear here, the cochlea coiled up. And if hypothetically we were to uncoil that cochlea, we'd see some sort of structure that looks a little like this schematic, and we can see the basilar membrane running through the middle of the cochlea here. And we know that the cochlea itself is tonotopically organized, where the regions on the basilar membrane that vibrate most readily to the high frequency stimulation are located at the basal end, and then as we progressively move up through the cochlear partition towards the apical end, then these regions get progressively more and more easily vibratory to lower and lower frequency stimuli. Now this tonotopicity is of course preserved throughout all the other regions of the central auditory system, so that when we get up to the auditory cortex, which is of relevance to the ALR, then the neurons are also tonotopically organized to mirror this effect that first occurs down in the periphery, down at the basilar membrane. So we can see that these neurons that are located medially on the temporal lobe here correspond with the black figure here to the high frequency stimulation down here, and then as we progress more and more towards the lateral regions of the auditory cortex here, then these neurons respond progressively to, or at least respond mostly or most readily to lower and lower frequency stimuli. So what of the ALR adaptation effect, and how is this relevant? Well, first of all, let's take the first example that I showed on the previous set of traces, and that was the ALR and the MMN to a standard deviant difference that was very large. This was a standard of 1000 Hz and a deviant of 3000 Hz. So because the difference was very large, then the discrimination effect is relatively easy, and so we see a very early MMN, and this MMN overlaps with the ALR itself, but we also saw a big difference in the ALR between the standard and the deviant. So what I want to illustrate here is let's for example imagine that the 1000 Hz stimulus stimulates this region mostly on the basilar membrane here, and this region on the basilar membrane is represented at the cortex by this population of neurons up here. So these populations respond mostly to a sound of 1000 Hz. And of course that 1000 Hz sound, being the standard, is presented very frequently. It's presented 80% of the time in this oddball paradigm. So these particular neurons, because they respond often, then more often of the time, then they'll be in a process of adaptation. That process whereby the neuron needs to recover adequately from one impulse, from one sound impulse, but before it can respond in the same way to the next impulse. There's a short recovery time known as during which the neuron's in a period of adaptation. Now let's consider the neural response to the 3000 Hz tone. So that would, being a higher frequency, might be expected to stimulate a region on the basilar membrane down here, much further towards the basal end of the basilar membrane, and that corresponds to a population of neurons over here, and this population of neurons are relatively far away from the first set. And because this is a deviant stimulus, then it occurs with much lower probability, and so not only are these neurons far away, but they're stimulated less often, so they're less often in refractoriness, and so that means that when a deviant does come along, there are more often they'll be relatively fresh and able to respond readily to that deviant tone. So not only does the MMN occur earlier, but also the amplitude of the ALR is increased because more of these stimuli are fresh and ready to fire. Now let's go to example number 2. So this example was where we had a slightly smaller difference between standard and deviant. This was 1000 versus 1032 Hz this time. So we'll just remind ourselves of the area and the population of neurons that respond to the 1000 Hz tone. Now the 1032 Hz tone, being closer in frequency, would be expected to stimulate the basilar membrane in a much more overlapping region, as shown with this circle in the bottom right here. But that means that the population of neurons that represent this activity are much closer to the population of neurons that respond to the deviant. And you can see that there's a region in the middle here that would be expected to respond readily to both standard and deviant. So what this means is that while the process of discrimination is a little harder, because the memory traces from these stimuli are more similar, so that means the MMN occurs with a slightly longer latency, but it also means that there are a fewer number of fresh afferent or fresh neurons ready to respond to the deviant when that comes along, because more of them, in this case these overlapping ones here, have already entered into their adaptation effect due to the multiple presentations of the standard. So there are fewer fresh afferents, and these fresh afferents might be shown in this region over here. So there is a small difference in the ALR, but it's a lot less than the previous example. Now let's move on to the third one. This is where there's very little difference between standard and deviant. The deviant's just 4 Hz different from the standard. So again, if we remind ourselves, the region on the basilar membrane that responds to the standard and the population of neurons that respond. But then when the deviant comes along, then it stimulates a very, very similar region on the basilar membrane, because it's just very, very small difference in frequency. So this means that it's very hard, or if not impossible, objectively to identify the process of discrimination, so we don't see the MMN. But it also means that almost the same set of neurons that respond to the standard also respond to the deviant, so there are few, if any, neurons that are not driven to some extent to adaptation by the standard when the deviant comes along. So this means that the ALRs to the standard and the deviant are very, very similar in amplitude. So this is the ALR adaptation effect. So now that we have a notion from the example of frequency deviations, what the MMN is and how it also relates to the ALR, I'd like to just go through a few practical considerations on how exactly to measure the MMN. So we'll mention just a bit about patient instructions and what they're actually doing. We'll just mention a few comments on the recording montage, where you place the electrodes, and also certain sources of noise, electrophysiological noise. So, first of all, patient instructions and tasks. Now, you may recall from an earlier slide that I tried to stress the MMN being an obligatory response, a pre-attentive response. This means that the MMN will occur irrespective of the active attention that the individual plays to the sound. So, in fact, we'd actually much rather they were doing something to try and distract them away from the sounds themselves. This might be ideally something like watching a movie or reading a book. The reason why is that if they're absorbed in completely or fully absorbed in a different task, then it's unlikely that we will get attentional dependent or endogenous responses such as the P300 occurring, which may or may not muddy the waters, so to speak. Another endogenous or attentional dependent response, such as the N2B, looks very, very similar to the MMN. So the more distraction that we can offer the patient, the better. But if you do see this N2B or P300 occurring, then it's likely that that is caused by the individual happening to notice a deviant occurring and then their attention switching to that deviant. But all in all, the MMN needs to be stressed, is not dependent on active attention. In terms of the electrode montage, well, it's most commonly measured with the reference on the nose and then active on the vertex. Now we have different options for different positions of the active electrode over different places on the scalp. Usually the MMN inverts in polarity as you move away from the vertex position and then down towards the mastoid. So the point at which you place the electrode below the Sylvian fissure, the MMN should invert. This is actually quite useful for distinguishing the MMN from the N2B, which doesn't invert when you get to that position. But typically in a system such as the Eclipse, where you have one or two channels available, then this might be a typical electrode montage. This is the Eclipse itself, and I'll just show you the collector cable arrangement for that particular montage. So if you're using the two-channel arrangement, that's the EPA4 collector, then you'd have the two channels jumped, and then the reference would be on the nose there, and the active on the vertex. Well, more conveniently, you might choose just the three-channel collector, and then we can have those three electrodes corresponding to the montage that I just showed previously. Of course, before any type of evoked potential measures, we'd hope to ensure that for the best, the least noise in contaminating our system from external sources, that we'd have low impedances, and we'd typically recommend impedances across the 3 electrodes of 3 kiloohms or better. Now, so that's external noise, but what about internal or electrophysiological noise? What I'm displaying on this slide here is just some example data, just over a period of a few seconds latency, and you can see that the stimulus train here corresponding to that latency range. Now, because the individual is awake with passive attention, such as watching a movie or maybe reading a book, then we'd expect from time to time there to be artifacts, and a large source of artifacts comes from eye blinks. So what I'm displaying on the top right here is a topographical representation of the head of the size of the artifacts as it spreads throughout the over the scalp, that's driven by artifacts from the eye blinks. So you can imagine the largest area of contamination will be towards the front, and then as we get further and further away from where the eyes are, then the contamination gets less. But you can see from the raw traces, so these are the these peaks, these biphasic peaks of the eye blinks here, and you know, quite large, sort of 200 or more microvolts. But that contamination spreads through other places where we might have the electrode. So for example, if we had the CZ electrode as we recommended, then you would expect artifacts to contaminate that response, as I'm showing here with the pointer. So in order to get around this, we'd recommend relatively stringent artifact reject criteria. Sometimes, due to the fact that the patient's sitting up, there may be acceptable to relax the artifact rejection levels somewhat. Now what I'm going to do, now that we have some of those concepts cleared up, is just spend a few minutes going through this video. Now it's a dramatically speeded up video showing the process of actually gathering the MMN using the Eclipse device. So we've got a patient who's wired up with the electrode montage that I just described, and we're going to be playing an oddball paradigm with 1000 versus 1500 hertz sound, and the deviant is going to be presented with a probability of 20% and the standard a probability of 80%. So here we go. Now, as you can see from the examples I've already given, my personal preference is to overlay the standard and deviant, which is what I've just done here in the middle of the screen, and then at the bottom of the screen you can see the difference waveform. Now, just to speed things along to the end stage there, so we see the MMN labelled here, and the ALR labelled over here, and the difference between them is apparent from the peaks in the difference waveform at the bottom there. And that recording might take somewhere on the order of 20 minutes or so to collect 200 repetitions of the deviant stimulus when it occurs 20% of the time. So, on to some of the clinical applications. Well, firstly, I hope you're convinced that the MMN itself, I think, provides a fascinating insight into some of the pre-attentive memory abilities of the central auditory system. But of course, a valid question would be, whilst this is all very well, how might it help us in clinical situations? And in our case, that's of course involving those with either hearing difficulties or perhaps some of the types of cognitive impairment where short-term memory is of a particular interest. So, as you can see from the slide here, I've mentioned a number of possible clinical applications, and anyone who wants to read this into this in a bit more detail, I'd draw your attention to this reference that I've cited here, Duncan and others from 2009, who provide a very interesting and concise overview of the clinical applications of the MMN. But first of all, the first point as an index of neurodegenerative disorders. So, in healthy individuals, adult individuals, the memory traces of the standard sound are thought to last for around 5 to 10 seconds. And so what we have here is an indirect way to kind of probe the pre-attentive memory abilities, how long that memory trace lingers within the auditory system. And sometimes, for example, with sometimes under normal circumstances, like with age, but also with conditions such as Alzheimer's or multiple sclerosis, that memory trace for the standard is thought not to last or not to linger as long within the auditory system as normal. And so that means that the size of the MMN is going to be correspondingly lower. Whenever a deviant comes along, if the memory trace for the standard has already started to dissipate more quickly, then when a deviant comes along, there's a lower likelihood of it to elicit the MMN. So the MMN is going to get lower. And so the size of the MMN, at least on a group level, can be used to index either the presence or absence, or monitor over time the development of neurodegenerative disorders such as Alzheimer's and multiple sclerosis are just two examples. Coma prognosis. Well, this one is a very interesting and somewhat promising line of investigation, you might say, where the presence of an MMN is used to some extent as a predictor of the likelihood of someone awakening from their comatose state. So, so I mentioned the MMN itself is pre-attentive, and whilst under normal circumstances, likelihood is that you'd have the patient awake. It doesn't actually depend upon awakeness, and it can be measured in individuals who are in a coma. And if the MMN is present in that person in a coma, then there's an increased likelihood of that person to awake from their comatose state than someone without. Schizophrenia, I've mentioned here, sort of falls within a similar category as the first bullet point, in that you would expect a reduced MMN amplitude, perhaps related to a lack of attentional shifting to, or lack of a trigger for an attentional shifting to a new stimulus, in this case an auditory stimulus. So this is a good example where it can help to, the MMN can help to shed light on some of the actual mechanisms of a disorder, as well as potential for sort of directing treatment options. And so individuals with schizophrenia tend to show the reduced MMN, but also it might be a predictor of who else, such as relatives, family members who might be at risk of such a disorder, by measuring their MMN as well. Whereas on the other hand, population with a stroke or some kind of more of an acute, that might be the MMN might be useful in determining some of the specific types of auditory discrimination that have been affected by the stroke. There's been a lot of work from people such as Krauss and Bishop and others into using the MMN as an outcome measure for auditory training. So what I'm referring to here is individuals with dyslexia or other processing disorders whose discrimination abilities might be impaired. And so, of course, the MMN might be used to assess those individuals, but it also might be used as a way to track the progress following a training program or a rehab program. And now all of these applications are, I would say, potential applications, because it's known that at least on an individual level, the MMN is problematic and has a very high variability. One of the reasons for this is because of the time it takes to record sufficient numbers of deviant stimuli to obtain an adequate signal-to-noise ratio. So just bringing the talk to a close now, we have the MMN here, which extends or potentially extends the diagnostic power from just an auditory detection index to that of discrimination, and it's useful in that it doesn't depend on active attention to those sounds. But as I was just mentioning, measures of MMN can be difficult to obtain and interpret easily on an individual basis, as you would need in a clinical application, but they certainly can shed light on a group level, can shed light on various clinical disorders such as some of the ones that I mentioned. One of the main difficulties or challenges is in the adverse signal-to-noise ratio that results from the low probability of a deviant occurring, and yet the need to record many deviants to get an adequate response. But I should note some of the optimal stimulus recording recommendations that are provided by Duncan in that reference that I just provided, and might be a good way forward in progressing the field. Okay, for anyone interested in that reference and some others of note, then I'll just draw your attention to this slide whilst drawing overall our discussion today to a close. So allow me just to thank you very much for your attention, and very much look forward to seeing you again in a future iteration of the webinar series brought to you by the Interacoustics Academy. Thank you.